Hello. Today I want to share with you some numbers and some both hope and information that will be important as we move forward during this period of time. So the good numbers, and the good numbers are that we've vaccinated over 900,000 people in New Jersey. And that is a wonderful, wonderful testament to the fact that people are coming forward for the vaccines, and we're starting to see a steady state. You've probably heard the announcements that I heard this week that there'll be another 1 million vaccines that are coming to local pharmacies. We don't know yet how those will be distributed or how you'll register for them, but it shows us that indeed that for those of you who are so anxious to be able to get your vaccine, there'll be yet another vehicle to be able to do that. We're thrilled that we've vaccinated over 20,000 people total. That again is another example of the hope of making sure that we're taking every possible opportunity to get vaccinated. I always like to share with you brief stories about the people who've actually received the vaccine and tell you what went into their decisions. Meredith Spida, one of our infection control experts and safety coaches, has a very special approach to this, and her unique review of it as a nurse looks at the science, always driven by the science. And while she was hesitant because she is breastfeeding and has obviously a young baby, she made a decision that it was better to have those antibodies in her and in her child than to not have them. And she made those decisions based on the data that was available to her and after some really careful conversations and heartfelt discussions, both with clinicians as well as with her family members. And speaking of clinicians, one of the clinicians I turn to for expertise in this area is Dr. Evelyn Balogun. Dr. Balogun is in charge of our urgent cares and occupational health. And she is of most concerned in not only making sure our staff have accurate information, but the broader community actually has accurate information to be able to make those decisions. Dr. Balogun is most concerned about the African American community. And it's not only the issue of getting vaccines to them, there's a real hesitancy. And I'll let Dr. Balogun tell you in her own words why she has concerns and what she wants to say to people in that community.
Communities of color have been disproportionately affected by the pandemic. It is disheartening to see that the rates of vaccinations are not really mirroring the impact that the virus has had on these communities. The current data suggests that only about approximately 5% of African Americans who are eligible for vaccines have received the vaccine. So there's still a lot of work to be done. And certainly the work needs to factor in issues around trust, issues around knowledge, education, and making sure that we also create access points for those that want to be vaccinated. And in the communities of color as well, we need leaders to step forth and speak to not just the science, but speak by leadership, by getting vaccinated.
Dr. Balogun is going to speak with other experts on February 18th at 2 o'clock in our town hall. Again, this provides you the opportunity to ask your specific questions to our experts. We do have a registration process, and there are lots of people who have registered already, so we're excited about that and excited about the opportunity to speak with you. So until we meet again, remember, wear your mask, remain socially distanced, wash your hands, and get the vaccine. Be well and stay safe.